Welcome to our exploration of what happens if you stop brushing your teeth for a month. This video will examine the progressive effects on your oral health when regular brushing is completely abandoned. We'll look at the scientific evidence on how quickly problems develop in this unhealthy but educational thought experiment. Expert opinions from dental professionals confirm that even short periods without brushing can have significant consequences. It's important to note that this is not something you should try yourself, as the consequences can be serious and long-lasting. Over the next 30 days, we'll track the progression of oral health issues that develop when someone abandons brushing completely. Let's begin our journey by examining what happens during the first few days without brushing. Within just 24 to 72 hours of stopping brushing, a sticky film called plaque begins to form on your teeth. This biofilm contains millions of bacteria that naturally live in your mouth. By the end of day 1, bacteria have already started attaching to your teeth. These are mostly the same bacteria that were already in your mouth, but now they're beginning to form colonies. By day 2, these bacteria multiply rapidly and begin producing a sticky substance that helps them adhere to your teeth and to each other, forming a more organized community. By day 3, plaque has formed a mature biofilm structure. This is when you'll likely notice that fuzzy feeling on your teeth when you run your tongue over them. Your breath will also begin to develop an unpleasant odor as bacteria multiply rapidly and produce smelly waste products. Without brushing to disrupt this biofilm, it will continue to grow thicker and more organized. This is just the beginning of what happens when brushing stops. The plaque that forms in these first 3 days will continue to develop and cause more problems as time goes on. By days 4 to 7 without brushing, several noticeable changes begin to occur in your mouth. As plaque continues to accumulate, bacteria produce volatile sulfur compounds that cause halitosis, or bad breath. The bacterial coating also begins to interfere with your taste buds, affecting how foods taste. By the end of the first week, your gums might begin showing the first signs of inflammation, appearing slightly redder than normal. These changes in breath, taste, and gum appearance are early warning signs of deteriorating oral health. During days 8 through 14 without brushing, gingivitis begins to develop. As plaque continues to accumulate along the gum line, your gums begin to show signs of inflammation. Your gums become increasingly red, swollen, and tender. This is called gingivitis. You may notice bleeding when eating harder foods or when touching your gums. This inflammation is your body's immune response to the bacterial invasion at the gum line. During this period, the plaque begins to harden into a substance called calculus or tartar. Once plaque hardens into calculus, it cannot be removed by resuming brushing and requires professional cleaning by a dentist or hygienist. By the 3rd week without brushing, all symptoms intensify significantly. The bad breath becomes severe and persistent as bacteria multiply and release sulfur compounds. The plaque biofilm thickens and becomes more complex, harboring increasingly harmful bacterial species that thrive in this environment. Gum inflammation worsens with more pronounced redness, swelling, and bleeding when brushing or flossing. You may experience discomfort while eating, especially with hot, cold, or acidic foods. By the 3rd week without brushing teeth, all symptoms intensify significantly, creating a concerning oral health situation. Without regular brushing, tooth decay accelerates dramatically over time. Let's examine how a healthy tooth progressively deteriorates when plaque isn't removed. Bacteria in plaque feed on sugars from your diet and produce acids as a byproduct. These acids dissolve minerals in your tooth enamel, causing white spots to appear. This is the first visible sign of decay. If this process continues, the enamel eventually breaks down completely, forming a cavity that can penetrate deeper into the tooth. People with existing dental work like fillings are particularly vulnerable. Bacteria can accumulate around the margins where fillings meet tooth structure. To summarize, without regular brushing, tooth decay rapidly accelerates in several stages. The bacterial growth and resulting decay can progress quickly, especially in people with high sugar diets or those with existing dental work. This accelerated decay not only affects your teeth, but can impact your overall health as well. Systemic health connections reveal that poor oral hygiene affects far more than just your mouth. Research has established clear connections between oral bacteria and various systemic conditions throughout the body. Bacteria that accumulate in your mouth due to poor oral hygiene don't necessarily stay there. The inflammatory response triggered in your gums can lead to increased inflammatory markers throughout your bloodstream. One significant concern is heart disease. Oral bacteria have been found in arterial plaque, and inflammation can damage blood vessels. There's also a two-way relationship between gum disease and diabetes. Poor oral hygiene can worsen blood glucose control and increase insulin resistance. Research has even found connections to brain health, with potential links to cognitive decline when oral bacteria enter the bloodstream. While 1 month of poor oral hygiene might not cause serious systemic issues, it represents the beginning of potential health problems. The longer poor oral hygiene persists, the stronger these connections become to heart disease, diabetes complications, and other serious health problems. Understanding these connections highlights why maintaining good oral hygiene is essential for your overall health. Resuming brushing after a month without proper oral hygiene won't immediately reverse all the damage that has occurred. Some conditions are reversible with proper oral hygiene, while others require professional dental treatment. Gingivitis, early plaque, bad breath, and gum inflammation are generally reversible with consistent brushing and flossing. However, calculus, cavities, deep gum pockets, and gum recession require professional dental intervention. Any calculus or tartar that has formed during the month without brushing requires professional removal by a dentist or dental hygienist. Unlike plaque, calculus is hardened and cannot be removed by regular brushing and flossing at home. The recovery process takes time. When you resume proper oral hygiene after a month, your gums will gradually improve over several weeks. Initially, your gums may still be inflamed and bleed easily when you brush. Over the following weeks, with consistent care, the inflammation will gradually decrease. Even with diligent home care, your gums may take several weeks of consistent brushing and flossing to return to a healthy state. Despite improved oral hygiene, some damage may be permanent without professional intervention. Gum recession, where the gum tissue pulls away from the tooth, exposing more of the tooth root, may not reverse on its own. Any cavities that developed during the month without brushing will need professional treatment by a dentist. These conditions require professional dental treatment and may be permanent if left untreated. To maintain healthy teeth and gums, proper oral hygiene practices are essential. Brush your teeth twice daily for a full 2 minutes using fluoride toothpaste. Use gentle circular motions to clean all surfaces of your teeth, including the outer, inner, and chewing surfaces. Don't forget to brush along the gum line where bacteria collect. Floss daily to remove plaque and food particles from between your teeth where your toothbrush can't reach. Use about 18 inches of floss, wrapping the ends around your fingers for control. Gently slide the floss between teeth and curve it around each tooth in a C shape, moving to a clean section for each new tooth. Using an antimicrobial mouthwash after brushing and flossing helps reduce bacteria and plaque. Swish for 30 to 60 seconds to reach areas your toothbrush and floss might miss. Look for products with the ADA seal of acceptance, and consider alcohol-free options if you have sensitive gums. Limit sugary foods and acidic drinks that can erode tooth enamel and contribute to decay. When you do consume these items, try to have them with meals rather than as frequent snacks throughout the day. Drinking water after eating helps wash away food particles and neutralize acids. Schedule regular dental checkups every 6 months. Professional cleanings remove tartar that can't be eliminated by brushing and flossing alone. These visits allow for early detection of problems like cavities, gum disease, or oral cancer when they're easier to treat. Your dentist can also provide personalized advice for your specific oral health needs. When choosing between manual and electric toothbrushes, consider that electric models are generally more effective at removing plaque. They often include helpful features like built-in timers to ensure you brush for the full 2 minutes. Electric toothbrushes require less technique, making them particularly useful for children and people with limited manual dexterity. However, a manual toothbrush can still be very effective when used with proper technique. Remember that consistent daily oral hygiene prevents the progressive damage we've discussed throughout this video. While poor oral hygiene leads to decay and gum disease over time, good habits maintain healthy teeth and gums. By following these practices, you can avoid painful and expensive dental problems in the future.